Namaste everyone, my name is Prashant Kumbar and I am a second year MBBS student and I am here to make anatomy a little bit easier for you people. So today I have chosen basic anatomical terminologies and let's study about some basic terms of anatomy, and we don't have much topic left today, just basic terms, then joints, and then we'll end up this session. Okay, so let me first divide it into two. Okay, so first one, just remember in an antagonist way as opposites, anterior and posterior. The word I already used, anterior, where? In anatomical position. How anatomical position is? It is anteriorly. Okay, the front part of the body is known as anterior. This is the front part known as anterior. Okay, and this back part is known as posterior, or in other ways, simpler and the most accurate is, you can tell in this way: anterior is the one which is front and posterior is the one which is at back. It depends with reference to. Okay, you can't just say posterior if there is no anterior. Then second, superior and inferior. Superior and inferior. Okay, superior, what it is? It is towards head, and inferior is towards feet. Front aspect of body. Superior towards head, and this inferior is towards feet. Okay, then third, central and peripheral. I think everyone knows this. Central and peripheral. Okay, fourth one, it is medial and lateral. What is the difference between these two? Medial, it is the plane, it is towards median, and then lateral is away from median, away from median. And what is median? That's our next term, median. This does not means that much. In simple ways, as I have already said about this, median is in mid sagittal plane. Median, it's the other name for mid sagittal plane. I've already said about this here. Okay, then next we'll go to intermediate. intermediate plane. What is this? By the name itself is suggests it is in between something. And what are those? In between medial and lateral. Why did I underlined L? Because don't confuse between medial and median. Okay? And some more are there. Superficial and deep. I think many of you know already these terms. These are simpler, easy to understand also. Superficial and deep. Superficial, it's which around with the contact of the air, our skin. Deep is like the inner tissues among them, inner layers. Next, dorsal and ventral. Of course, you would have heard about this dorsal and ventral. Dorsal, it's our back, towards back, ventral, towards belly, or in other words, abdomen. Okay, next, we have one more important. I think you have not heard. It comes in surface anatomy. I'll even make a video, which describes anatomy, which classifies into many different anatomical methods. Yes, there are many different anatomical methods, and even some more information about who is the father of anatomy, a little bit history. Okay, but basic terms, the first. Next, let's go to 9th. Cranial and caudal. What are these? Cranial, it is our head. Towards head. What was one more? Superior. Yes. And caudal towards tail. What do you mean by tail? Sacrum and coccyx bone, tailbone. Next. One more thing. Cranial is also known as rostral. Rostral. Okay. Next. Some complex like invagination and evagination. Okay, invagination, it's like protrusion, inward protrusion. Inward protrusion. And what is evagination? Evagination is outwards protrusion. And what do you mean by this? If there is a cell and some particle is entering into this, then how it will be? Like this particle will be here. It is engulfing. It is invagination, inward protrusion, right? Evagination is similar. Next. Interior. You know interior. It's inside hollow organs. And here comes two more terms which are important. Ipsilateral and contralateral. So ipsilateral means it is on the same side of the body, like For example, how to say, your right hand and right foot are on the same side of the body, right? And contralateral, it's like opposite sides. Opposite side does not only means like left hand and right hand, it can also mean sternum and the vertebral column, right? Both are contralateral, both are on the opposite sides of the body. Okay, next, proximal, distal, one more. In other ways, proximal and distals are not that much different than cranial. Superior, inferior, cranial, caudal, proximal, distal, all look similar. But where to use? Cranial and caudal are used in terms of thoracic stuffs. Okay? Proximal and distal comes in limbs, like your shoulder. Humerus bone is head of humerus is proximal, shoulder is proximal, your hand is at a distal. Okay, where does superior and inferior comes? If you are discussing about a single part, okay, a single part, then you talk about superior and inferior. Like example, there is a blood vessel, okay, or exam, yeah, let us take in this way. There is a art, okay, this is inferior vena cava, this is superior vena cava. Okay, this is a single blood vessel, vena cava, and this is superior, this is inferior. Why? Because it brings blood from all, and it is superior towards head. Okay, so when you talk about a single part, when you talk about a thoracic region mostly, and proximal and distal, of course, for limbs. Okay, yes, this is the descriptive terms, you have to know about them, really helpful. Next, terms used to describe joint movements. What are these? See, everyone knows what is a joint, and many of you I have read about synovial joints. But as you study in anatomy, there are many different joints. There are suture, synovial, and many much more. So these are some basic terms for joints. Okay, and these are in relation with axis, planes. Okay, come, let's go to flexion and extension. Okay, what is flexion and what is extension? The main difference I am going to tell you, through which you can find out, because it confuses a lot to many people. First one, flexion. Okay, flexion, it decreases angle. Okay, and movement takes place in sagittal suture, sagittal plane, sorry. Usually it is anterior one. Okay, usually anterior, but sometimes or occasionally posterior movement. Let's know how it is. It decreases the angle. Let's go upon its characteristics. Decreases the angle. So this is your hand. If you're moving it back or front, which side the angle decreases, that you have to look for. Okay, see here also, if you go up, this is 180 degrees. If you go up, it will become right angle decreases. That's what flexion, raising up. This is flexion. And what is extension? Opposite of that, increasing angle. Okay, and there are some points like which you have to remember. Okay, when dorsum of foot is elevated at ankle joint, this is known as dorsiflexion. Dorsiflexion. There is one more word which can confuse you. Next, when you press the foot downwards as raising the toes, foot or else pressing the foot downwards and rising toes. This is known as plantar flexion. Okay, one is dorsiflexion when you elevate the dorsum of the foot. Another is plantar flexion when you just rise the toes and the foot will be on the floor itself. Okay, one more, lateral flexion. What it is? Coronal plane, you remember? It is frontal plane. Movement of this is lateral flexion. Movement of trunk, in which in coronal plane, then this is known as lateral flexion. What do you mean by trunk? Your vertebral column. So if you move your trunk in the coronal plane, that is frontal plane, it's lateral flexion. Okay, you should remember the main thing here is it decreases the angle. It's the movement in sagittal plane. Okay, these three are extra points which I have given you. Okay, here is the flexion and here is the extension. We'll even write about the extension. Next, flexion of hip joint. This is 180 degrees. If you raise this upside, angle decreases. Flexion at knee joint, angle decreases. So if you raise up, raise back side, this is posterior. In lower limbs, flexion is anterior, I said, but in lower limbs it is posterior movement. Okay, then dorsiflexion, that means this is the dorsum of the foot, and when you elevate this, it is dorsiflexion. When the foot will be kept as it is but toes will be raised, plantar flexion. And this is flexion of fingers. What do you mean? Just curl them. That is flexion. Why? It decreases the angle. Now let's talk about extension. So as in flexion, here it's the opposite. It means it increases angle. Okay, right? Then we said it's the movement in sagittal. This is also the same. That's the reason I said this is this should be your main important point. You have to always look for differences. That's how you should read. That's how you should correlate things. Okay? Yeah. Now it will be easy for you. Okay, then it increases the joint angle of the joint, of course. Example, extension of elbows. Extension of elbows. It is the elbow joint. Okay, it is extending. Understand? Okay. Or even you can see here. This is extension. Why? Your angle is this much. When it extends, it becomes more. Increase in angle. When you extend them, that is back side, it becomes extension. Now there are some other terms here under extension known as hyper extension. Hyper, it's a more, right? When a body part is extended beyond the anatomical position. When a body part is extended beyond anatomical position, so that its angle will be greater than 180 degrees. Okay, like example, I'll give bending of head. Bending head backward. How? Let us see. Okay, so this is a person. It is his head in a normal position. He is peeping down, looking forward on the ground. So here what happens? He is moving forward. He is bending down. Bending of the head forward. So what is this? This is flexion of neck. Flexion at neck at this point. Next. This is flexion. This is flexion. And this is extension. Okay. What is hyperextension now? It means a person is bending his head backside. Okay, he is moving forward. This is the forward direction, so that it indicates this side is anterior. Next, just see, he is bending it backside, and see the angle here. This is the mid sagittal plane. Angle is 180 degree, and he is still more bending back. Okay, see this angle. It is more than 180 degrees. It is extending its anatomical part, head. How? Beyond anatomical position. It is not erect, it is moving back. And example is bending head backwards. Some people, even what they do, this and, right? They just at elbow, they can take it a little back. You might have seen greater than 180 degrees, right? That again comes in hyperextension. Okay, so this was flexion and extension. I think there are no doubts in this topic, flexion and extension, because it is important, and you might have got cleared with this topic. Now abduction and adduction. The name itself says abduction means abducting something, abducting a body part from its sagittal plane. Okay, from away from midline of the body, that is away from sagittal, median, abducting a part away from median in coronal plane. Okay, and here adduction, what does this means? It means movement towards, it is adding movement towards midline of the body. Okay, I'll just mark it so that you can easily notify it. Abduct and adduct, add. Okay, you can see here now. In coronal plane, what is coronal plane? Frontal plane, right? It passes perpendicular to mid sagittal. Okay, in that plane it is abducting. Why? From mid sagittal plane it is moving apart, and this is adduction, adding. Same, abduct, add. In case of fingers, in fingers, what is abduction? Abduction means spreading, and adduction means together. And this is with respect to your middle finger, third finger. There are names for fingers also. I think you might know. Thumb, index finger or forefinger, middle finger, ring finger, little finger. Okay, so this is abduction and adduction only in case of fingers and even in case of toes and toes. Okay, next. This is an important stuff again. Confusion. There are two topics combined. One is flexion and extension, other is abduction and adduction. You might see one more opposition here. Okay, so this is a flexion. How? Decrease in angle. I actually kept this one for your so that you could think about it. This is extension, increase in angle, extension of what? Of thumb. Now this is in coronal plane. Okay, abduction and adduction happens in coronal plane. Now this is the hand. Normally what is abduction? Removing of, it is okay, abduction, and adding the thumb back to its normal position, back to its anatomical position, is adduction. Okay, removing anything from its anatomical position is abduction, and opposite is adduction, right? And one more thing, this is the opposition where the thumb and the little finger oppose each other. Okay, this was actually the assignment, assessment, homework, anything you call. Next, we'll go towards rotation and circumduction. I know you are tired, and even I'm tired too, but wait for a little more and we'll finish this. I don't care about the time. The topic should be clear, crystal clear, and you people should understand that is my main motive. Right? Next, rotation and circumduction. In a simple way, I'll just finish it off in a minute. Now, what is rotation? It is movement of a part, movement around longitudinal axis, and it has two types. One is medial rotation, also known as inward. And what does this means? Anterior surface, it is turning towards medial, name itself says. Next, one more, lateral rotation, also known as outward, and the name itself says its anterior surface faces outside. I'll just write the definition of this, of only one, and you have to think of the other, just the opposite. Okay, it means anterior surface of the part faces laterally. Okay, this is rotation. What about circumduction? This is a circular cone-like movement. Circular cone-like movement. Okay, and it is possible in biaxial and polyaxial joints. What are these biaxial and polyaxial joints? You will get to know later in joints topic. Okay, so you have to wait. Yeah. Now, rotation, movement around longitudinal axis. This is the longitudinal axis, and around this longitudinal axis the movement is going in place, right? And anterior surface is facing medial side, so this is medial rotation. Here this is going outside, outward rotation, or anterior surface is facing outside, lateral rotation. Okay, circumduction, its example, best example is here in this pic. Rotation, complete rotation of your upper limb or even of your lower limb at hip, and this is at shoulder. Okay, complete rotation, it is circular rotation or even cone-like rotation. Done. Next, supination and pronation, easiest. What is supination? It is rotation of forearm and not or, and laterally from mid-prone position. What is this? Let me tell. So that palm and hand faces anteriorly. Supination is palm and face. It both faces anteriorly. Now, here, This is the supination one. What happens? Rotation of forearm. Okay, this is arm, forearm, and right. Rotation of forearm and even that of hand laterally. Understand? Laterally. And this is medially. Rotation of forearm and hand medially. It's pronation. And same applies to your lower limb, leg and foot. If you rotate them laterally, it becomes supination. If you rotate them medially, that becomes pronation. This is medially. Okay, the difference is in this laterally movement and medially movement. Okay, next, inversion and eversion. What it is? Inversion, it is movement of sole of foot, of course. It faces inwards. Understand? It faces inside like this. Sole of the foot is inside, so it is inversion. Here the sole is outside, and that's why it is eversion. Okay, sole faces outwards. Okay, inversion, sole faces inside, and eversion, sole faces outside. Next, protraction and retraction. What are these two? Protraction, and here is the best example. Okay, protraction, it is the movement of body part which moves forward on a parallel to ground, like movement parallel to ground. And what is, of course, it is opposite, retraction. Okay, but what's the main difference? It is also movement parallel to ground, but what's the main difference? It's the movement parallel to ground forward, and this, it's backward. Okay, so this is backward, this is forward. Let me explain. Here is your lower jaw. Okay, if you move your lower jaw forward, it is parallel to ground, of course. Movement parallel to ground, forward, it is protraction. And if you retract it, that is move it back to normal anatomical position, that becomes retraction. Examples is your lower jaw and your scapula. If you raise your shoulders a little bit up, what happens? Little bit up, showing some weird sign. The scapulas move forward, which is parallel to the ground. And in retraction, what happens? This moves backward, and that's retraction. Examples are that of a lower jaw and even of scapula. What is scapula? This part. This. Okay. Next, elevation and depression. Yeah, there's still much, but no problem. Elevation and depression, what are these? From normal anatomical position, elevation simply means movement, it is lifted. You can simply remember it as lifted. And depression in the sense opposite, of course it is opposite to elevation. It's depressing. Example, here you have the mandible. It is the normal anatomical position, but you are lifting it up. This is the normal anatomical position, you are depressing it. Lifting and depressing. That's all. Example, again, lower jaw. Lower jaw. Okay, even that of scapula. Next, what are the terms used to describe blood vessels? Terms used to describe blood vessels. Let's go in detail because this has some different terms which are difficult. First, everyone knows arteries and veins. What are these? Oxygenated blood, where? Away from heart. And veins carry deoxygenated blood. Where? Towards heart. Okay. Third one, anastasome. Listen carefully, the pronunciation. Anastomosis. What is anastomosis? This is what I said, important. It is the surgical structure between any structures, between structures. Okay. What does this statement even means? It is like, okay, here are arteries and veins. Alright. This is the artery and these are its branches. Okay. Here it is a vein, arteries, and here it is a vein, and vein as tributaries. What are tributaries and branches? Branches in the sense it grows in this way. Tributaries, it comes in the reverse way. Understand? Now, there is a communication between these two. Arteries are thick, veins should be thin. And here is the division of veins. These are the branches of arteries and these are the tributaries of veins, and in between them there is a communication, and that is anastomosis. It is the surgical structure. You can say it, surgical structure which is between structures, which connects them. Okay, it connects branches of arteries and tributaries of veins, and this structure is known as anastomosis. Understand? Next, we have even capillaries. Of course, everyone knows what is capillaries. These are microscopic vessels, right? Smallest artery and tributaries of vein, arteries and venules. These both get connected each other by microscopic vessels. Okay, and these are found in networks. Understand? Next, fifth one, sinusoids. Sinusoids. What are sinusoids? Sinusoids, these are small, these are thin walled blood vessels. These are small and thin walled blood vessels, but with irregular lumen. Irregular lumen. And this lumen this lumen is lined by endothelial cells. Endothelial cells. Next, collateral circulation. What is collateral circulation? It means accompanying. In other ways, it's a backup. Backup. What type of backup? If there is an artery which supplies to a particular part, okay, and this is that part. If this by any chance, if this gets blocked, then there will be an alternate pathway formed. This is alternate pathway. Okay, and this is blocked main artery. Okay, and this is what known as collateral circulation. If main artery gets blocked, an alternate anastomotic pathway opens. Okay, this is collateral circulation. This is of course artery. That's the reason I made it with red. Right? Arteries, vein. Next, one more left. Venae comitants. What is venae comitants? This is two veins accompanying an artery. How? Okay, what is this? Artery, and there are two veins on them. This is one vein which is on artery itself. Yes, these veins will be present on artery, and there is one more vein. Okay, if two veins are accompanying a single artery, a single artery, then that is what known as venae comitants. Done? Now, terms used to describe nerves and associated structures. Everyone knows what is a nerve? First one. Nerve, it is made up of nerve fibers, of course, and these are bound together by what? By bundles of fibrous tissue. Okay, next comes plexus. This is the new word, I guess. Plexus, it is nothing but braided structure resulting from network of nerve fibers. See, there are nerve fibers everywhere. Okay, and this structure, it is known as braided structure. Okay, so braided structure resulting from network of nerve fibers. Okay, third, ganglion. This you have heard in Animal Kingdom, 11th class biology, 4th chapter. What is ganglion? Ganglion, it is group of nerve cells outside central nervous system. And what is nucleus? It is group of nerve cell inside central nervous system. Okay, these are the terms, these are the four terms. Nerves, okay, you know them. It is bounded by fibrous tissue. Plexus, it is the braided structure which results from network of nerve fibers. Ganglion, network of nerve cell, group of nerve cells outside CNS. Nucleus is inside CNS. These are the terms used to describe nerve and their associated structures. Next, yeah, last 5 more minutes and the topic will be done today. Used to describe muscles. Everyone knows what is a belly. What is belly? It is fleshy, contractile part. Contractile part of muscle means where muscle will be much in a huge stuff. Okay, and this is contractile part, and then that is what known as belly of that muscle. Then tendon. What is this? This is fibrous, non-contractile. And what is tendon? Joins muscle. Where? To another muscle. Okay, don't get confused between tendon and ligament. Ligaments are the one which connects bone to muscles. Tendons are the one which connects muscle to muscle. Okay, then third, aponeurosis. What is aponeurosis? It's a flat sheet of collagen fibers from muscle, and it connects to bone. Attachment of bone. 2. So on it you have a galea aponeurosis. So here are the muscles, and for that it's a flat sheet on that which is of collagen fibers. So it starts from a muscle and it attaches to a bone. It's a flat sheet, and this sheet is made up of collagen fibers. Okay, next, what are origin and insertion? People think origin is the place where muscles originated, but the actual definition of origin is end of a muscle which remains constant or which remains fixed when during contraction. And one more term, insertion, it is not the place where muscle ended. Insertion, it is the place, or it is an end of a muscle which moves during contraction. Okay, so the difference which you have to remember here is it remains fixed, origin, insertion, moves. Okay, so there is a muscle. Okay, here it is origin, here it is insertion. Means if this muscle gets contracted, this part will come here. It contracts, it moves, but not the origin. Origin remains fixed. Done? Next, there are some more terms of muscles. We'll finish them off. 5. So sixth, bursa. What is bursa? Everyone might have heard bursa, but a lot of confusion in bursa. So bursa, it is actually a sac which is filled with synovial fluid. Okay, and this is found over the bone where tendon slides. Where tendon slides. So over the bone, if there is a tendon, and near that there will be a bursa. Bursa is basically it's a sac which is filled with synovial fluid. It's a sac filled with synovial fluid. Next, 7th. Synovial sheath of tendons. Synovial sheath of tendons. What it is? It is a double layered synovial membrane. Double layered synovial membrane. Tubes surrounding tendons. Surrounding tendons. If here there is a muscle, and there is a tendon here which connects these two muscles. Okay, surrounding this there will be two layered synovial membrane tubes. Surrounding this there will be like this double layered synovial tubes, and these each are how they are double layered. Understood? Synovial membrane, it's a double layered synovial membrane which is found around the tendons. Done? Next, there are 4 more. 8th one, prime movers. What are prime movers? Initiating a particular movement. Muscle initiating and even maintaining, not just initiating, it even maintains. Initiating and maintaining a movement. Such muscles are not called as prime movers, or they are called. Of course, they are called. Okay, so prime movers, what muscles are prime movers? The muscle which initiates, and even which maintains the movement. Next, 9th, synergists. 10th, antagonists. What are these? In simpler way, synergists are the one which assists prime movers and antagonists are the one which opposes prime movers. Then lastly, fixators. What are fixators? These are the muscles which contract isometrical to stabilize origin of prime movers. Muscles which contract isometrically, which contracts isometrically to stabilize origin of prime movers. Not understood? I know that. Why I am here to explain. Wait. Okay, so I have said you one thing here. Origin does not moves. Origin remains fixed, right? So origin of any muscles, it stabilizes origin. Oh, where is this color? Which color do you want to choose? Okay, this is the muzzle, this is the insertion point, this is the origin point. And when movement takes place, contraction or something, this initiator insertion point moves, not the origin point. These are the fixators. Around origins there are fixators. Okay, I'm just drawing this as points, dots, but they are not as dots. These are the muscles. There are some muscles which are present around the origin which contract isometrically. What does this means? How much this muscle contracts, that much even these fixators contracts, that is isometrically. If this muscle is contracting, so do the fixators also contract, so that this origin remains at the fixed place. Now read. Muscles which contract isometrically stabilize origin of prime movers. Okay, done. This is our last slide. Even I am happy. Not just you. Okay, only two more definitions. What are lymph nodes and what are lymph vessels? Okay, lymph nodes, these are glands. Not exactly glands, but gland-like structure. Okay, these vary in size. In size from like what? Head of pin to large bean. I think these lymph nodes occur when there is something happens to your immune system. These are related to your immune system, okay? And if you get any sort of allergies or any infection, these lymph nodes swell. Lymph nodes swell. Okay, if this swelling goes on, it becomes worse, but as allergies goes off, even this swelling goes off. Some rare cases it will be severe too. Lymph nodes, yes, really severe. Then lymph vessels. What are these? These are beaded tubes. Beaded tubes which contains clear fluid. Okay, and this clear fluid is nothing but lymph. Okay, and this is what known as lymph Lymph, it is found mostly in tissues. These lymph vessels are mostly found in tissues which are adjacent to epithelial surface, where they are found. Here, okay, I'll write it here. Found adjacent to epithelial surface in tissues. Example, skin, of course, epithelial. Elementary, again, these also have epithelial surfaces. Or respiratory, okay, tracts. Got it? So I'll just brush up everything within 1 minute. I'll just tell you what all we learned today. So we started with our positions. There are 5 basic position: anatomical position, erect and forward; fundamental position, erect and sidewise; supine position, lies on back and up, these are upside; prone position, lies on abdomen, face and feet downwards; lithotomy position, used for examination of pelvis and vagina, hips and knees are semi-flexed. Then planes we discussed, fundamental 4 planes, extra I have taught 2. Fundamental mid-sagittal, it is the one which passes, which divides body symmetrically. Sagittal, which does not divide symmetrically, but both mid-sagittal and sagittal divides longitudinally. Okay. Then third, coronal one, what it is? It's a frontal plane. It is right angle to mid-sagittal frontal plane. Then transverse, at any part of the body which should be parallel to ground, and it is also perpendicular to median. Extra, oblique, other than these 4 basic. Cardinal, it's the one which passes center of body. Okay. Next, descriptive terms. I have taught you descriptive terms. These are easy, just once you go through. Yeah, I'll mark it here. This you might have heard new. Next, used to describe joint movements, flexion and extension important. I've taught you about hyperextension, which is a new term. Then abduction and adduction. Rotation and circumduction. This is the part where people get confused. Okay, I'm putting a star. Star indicates easy to get confused. So you have to read them properly. Supination and pronation, then inversion, aversion, protraction, retraction in lower jaws and scapula, elevation and depression, especially in lower jaws. Then for blood vessels, arteries and veins, you know. Anastomosis, these are the surgical structures between structures. Capillaries, you know again. Sinusoids, irregular lumen, these have. What is the main difference between capillaries and sinusoids? Capillaries does not have irregular lumen. Okay, just write it down. Main difference between sinusoids and capillaries. Okay, then collateral circulation, that is alternate pathway. This is that alternate pathway. Next, vena commitans, 2 veins on a single artery. Next, nerves and associated. Nerves bounded by fibrous tissue, plexus, braided structure, ganglion, outside CNS, nucleus, inside CNS. Then for muscles, belly, fleshy, tendon, muscle to muscle, non-contractile, aponeurosis, flat sheet, origin remains fixed, insertion moves. Then bursa, filled with synovials, it's a sac. Synovial sheath, it has double layered around tendons. Prime movers, initiation and maintaining both. Synergist and antagonist, these two helps you in understanding muscle. understanding functions of muscles. Okay, then fixators. Next, lymph nodes. These are gland-like structure, very insides. Lymph vessel, of course, even lymph vessels are also lymphatic system complete. It related with immune system. Lymph vessels, these are tube which has lymph in them and found near adjacent to epithelial surface. And that's all. Thank you very much for being for such long time. It's more than an hour, and I guess you have understood the topics today, right? So meet you in the next session. Goodbye.